Right. So today we will be focusing on the ICD 11 changes, right? ICD 11 changes mainly with respect to the OCD part, right? OCD and dissociative part, because we have already covered the dissociative disorders, right? Now, just for a revision, right? Uh, how the division was there in ICD 10, right? So in ICD-10 we have F4 category, which which from F40 to F48 included neurotic, stress related, and somatoform disorder, right? And here like F40 and F41 were mainly related with the anxiety spectrum, right? Meaning F40 was your phobic anxiety disorder, F41 was other anxiety disorders. So the thing to note here was that ki the anxiety disorder in themselves were divided into two groups, in which phobia was separated from other anxiety disorders. And phobic anxiety disorders included your agoraphobia, social phobia, specific phobia, others, and unspecified, right? And other anxiety disorder included your panic disorder, GAD, mixed anxiety depressive, other mixed anxiety depressive, other specified, and unspecified, right? So this F4041, the anxiety disorders were divided among themselves, right? F4041, F42 was your obsessive and compulsive disorder, and it was like F42.0, mainly obsessions, mainly compulsions, mixed obsessive compulsive, others, and unspecified. F43 was your stress related, right? So it was a reaction to severe stress and adjustment disorder. It included acute stress reaction, PTSD, adjustment disorder, other, and unspecified. F44 was your dissociative group. We'll discuss ki how the division was there and what major changes have been brought out into the division. Dissociative group has also, the division has gone a major change. We'll see. F45 somatoform. The somatoform disorder has been removed. You know what was included in somatoform in ICD-10? It was somatization disorder, undifferentiated somatoform, hypochondriacal, somatoform autonomic, persistent somatoform pain, others, and unspecified. And finally, F48 was your other neurotic disorder. And in other neurotic disorder, we had neurasthenia, depersonalization, derealization, other, and unspecified. Right. So this was there in ICD-10. Now let me tell you what major changes have been made here, made in your ICD-10. Okay. So F40 and 41, which catered with the anxiety disorders, they have been combined together, right? So now we have a different category for anxiety disorders. And in anxiety disorders, phobic versus other anxiety disorders is not there. In anxiety disorders, we have like GAD, panic, agoraphobia, specific phobia, like this, right? Then OCD has been OCD. Earlier it was obsessive compulsive disorder F42, but now it is obsessive compulsive and related disorders, which include many other disorders, right? So OCRD is like equivalent to your like mood disorder category, like your psychotic schizophrenia and other psychotic disorder category, right? So obsessive compulsive and related disorders, right? Then again, this category, stress and adjustment, again has been given a separate name in the form of disorders associated with the stress, right? We have dissociative disorders with us. Okay, now firstly there earlier it was dissociative, and in bracket you will see written conversion disorders, right? So how it was written in your ICD-10? Dissociative conversion disorders. But now in ICD-11 it is just dissociative disorders. Conversion has been removed, right? And then interestingly, this somatoform has been, I should say, removed, renamed, and moved to a different category. We will see how. Other neurotic disorders not there as such, and DPDR, depersonalization, derealization, also has been moved to your dissociative category. Okay, now let's start with mainly OCRD group, obsessive compulsive and related disorder group, and our this one, dissociative group, right? Now, firstly, obsessive compulsive and related disorders. Let's see. Right? In obsessive compulsive and related disorders, the first category itself is how OCRD is divided. OCRD, obsessive compulsive and related disorder group, is L1 6B2. Okay. Anxiety disorders is your L1 6B0. Then after anxiety, OCRD. Then after OCRD, disorders associated with stress, which is 6B024. Then after stress, it is dissociative disorders, which is 6B6. Then after dissociative, we have eating disorders, eating and feeding disorders. Then after eating and feeding, we have elimination. And after elimination, we have disorders of bodily distress and experience. Right? So it is 6B6, 6B8, and it is 6C0. It is 6C2, right? So this is how the naming will be there. The alphanumeric coding, right, of anxiety disorders will be mainly 6B0, 6B2, 6B4, dissociative 6B6, right? So here we will be mainly focusing on OCRD 6B2 and dissociative 6B6, right? Now let's move to OCRD again. OCRD or 6B2, right? Now, in OCRD 6B2, the various disorders included are: one is OCD, then body dysmorphic disorder, olfactory reference syndrome, hypochondriasis, hoarding, and body focused repetitive behavioral disorders, which includes trichotillomania and excoriation disorder. Right? Now see, so it is 6B2, so OCD will be 6B20. BDD will be 6B21, 6B22, 6B23, and trichotillomania will be 6B25.0, 6B25.1. Right? So OCD, BDD. Okay, so obsessive compulsive related disorders have OCD, BDD, or olfactory reference syndrome, hypochondriasis, hoarding, body focused repetitive behavior disorder, trichotillomania, and excoriation disorder. Right? Now, what other things to note? Okay, we will be discussing OCD shortly. Body dysmorphic disorder is the new entity added. Earlier it was included it was embedded under. So if the person, as per ICD-10, in ICD-10, if the person had body dysmorphic disorder, you cannot make the diagnosis as per ICD-10 body dysmorphic disorder. It was actually hypochondriasis. So what I mean to say that in ICD-10 body dysmorphic disorder was embedded under hypochondriasis. And other thing to note that if you will see here, when we were discussing how F4 category in ICD-10 was divided, if you will see here, under somatoform we are including hypochondriasis, right? But what has happened now in ICD-10? So in ICD-10, under body dysmorphic disorder was embedded under hypochondriasis, which was a part of somatoform disorder. But now, what has changed regarding BDD, body dysmorphic disorder? It is a new entity in itself. One, not under hypochondriasis, and included in OCRD group, and not anxiety or not in under anxiety or so-called earlier somatoform group, right? Rather in OCRD group, right? Then BDD, body dysmorphic disorder. Olfactory reference syndrome again is the new entry. New diagnostic entry in ICD-11. Hypochondriasis, I am just telling you, hypochondriasis is hypochondriasis earlier had been under somatoform in ICD-10, but now it is under OCRD group, right? So from anxiety and the somatoform group, it has moved to hypochondriasis to OCRD group, right? Now we all see patients with hoarding disorder, be it with OCD group, obsessive compulsive group, schizophrenia group, right? So hoarding disorder is a common entity in psychiatry. But again, I will have to say that it is a new diagnostic entity, new diagnostic entry in ICD-11. Earlier, if hoarding disorder was there, it could not be specified, it could not be diagnosed anywhere as per ICD-10. But now hoarding disorder is a new diagnostic recognized entry under OCRD group, right? And as you can see, body focused repetitive behavior disorders. This is again, I would have to say, the terminology is new, right? You know, trichotillomania. Earlier, okay, so body focused repetitive behavior disorder is a new terminology. I am still not using the word new diagnostic entity. Why? See, trichotillomania earlier in your ICD-10, was under habit and impulse control disorder. But now we have habit and impulse control disorder, but now in ICD-11, it has moved from uh, habit and impulse disorder to OCRD group, obsessive compulsive and related disorder group, because more genetic similarity and family aggregation as of OCD group, right? So trichotillomania, right? And excoriation or skin picking. Excoriation disorder or skin picking disorder is also a common entity seen in ICD, is a common entity seen in psychiatric disorders, but excoriation is a new diagnostic entity. New diagnostic entry or new diagnostic entity in our ICD 11. Earlier, you could not make the diagnosis of excoriation or skin picking, but now it is a recognized disorder. And this trichotillomania and excoriation, trichotillomania earlier, which was coming under your habit and impulse, is now coming under body focused repetitive behavior disorder under ICD 11, right? So as I was telling you, ki this OCD, OCRD or OCD earlier in ICD-10 has gone a major change, right? I hope you are clear with it. Just a very quick thing, right? OCRD earlier was OCD. OCRD is now a different category, different from anxiety disorders and adjustment disorders, obsessive compulsive and related group. It includes OCD, which was the same, which in a way in on a major overview is same, but OCD group also has undergone some changes. We will see how, right? Then body dysmorphic disorder is a new entry. Earlier was under hypochondriasis, which was under somatoform disorder, right? Then olfactory reference syndrome, new entity. Hypochondriasis, okay, hypochondriasis is there. I'll tell you what. Oh, and hypochondriasis, as I just told, was under somatoform in ICD-10, right? Hoarding disorder. Hoarding disorder is a new entry. Body focused repetitive behavior disorders, which includes trichotillomania and excoriation. Trichotillomania was under habit and impulse control disorder, but now under OCRD. Excoriation or skin picking is new entry. And remember that key, as per ICD-11, we can include comorbid or co-occurring diagnosis, meaning if the patient is of schizophrenia and he has hoarding disorder along with, will make the diagnosis of schizophrenia and hoarding disorder and excoriation disorder. OCD plus hoarding disorder will be the diagnosis, right? So the diagnosis can be entertained in this way as per ICD-11, right? Now coming to the OCD, obsessive compulsive and related disorder, right? So under OCRD, OCD is there firstly, right? Which is 6B20, right? Now OCD, firstly, what has changed in the definition, right? Now, as per ICD-11, the obsessions are being defined as obsessions are repetitive and persistent thoughts, images, or impulses or urges. that are okay, repetitive, unwanted, intrusive, associated with anxiety. Yes. So obsessions are repetitive, persistent thoughts, images, or impulses or urges. So ICD 11 is including your obsessions as obsessions can be thoughts, images, impulses, or urges. Just a minute. Whereas, you know how, though the change is minor, but in ICD 10, how were the obsessions defined? They told that they told that in OCD, obsessive compulsive disorder, they told that obsessive thoughts are ideas, images, or impulses, right? Right. So what I mean to say that, okay, rest the same. So what I mean to say that if you will notice, in ICD-10, under obsessive compulsive disorder, they were just recognizing thoughts, and they told that the obsessive thoughts can be ideas, images, or impulses, as opposed to ICD-11, which told that the obsessions can be thoughts, images, impulses, or urges. Right? I hope you have got this minor difference, right? Though in OCD, in ICD-10, obsessions were recognized as just the obsessive thoughts, though the thoughts can be ideas, images, or impulses. But in ICD-11, it can be obsessions, can be thoughts, images, impulses, or urges. Right? One. Even if you will see the definition of compulsions, so even if you will see the definition of compulsions in ICD-10, in ICD-10, compulsions were compulsive acts or rituals that are stereotype behaviors that occurred repetitively again and again, not enjoyable, etc., etc., etc. Right? So here they were telling in ICD-10 that the compulsions are acts of rituals associated with repetitive behavior. Not person does not want to do them, etc. But how it has been defined in our ICD-11, in ICD-11, they are telling that in ICD-11, they are telling that compulsions are repetitive behaviors, okay, that are in repetitive behaviors, including repetitive mental acts, including repetitive mental acts. Firstly, that the individual gets driven to perform in response to obsessions. And okay, so repetitive behaviors including repetitive mental acts that the person has to perform in response to, that the person performs in response to either obsessions according to rigid rules, or even to achieve a sense of completeness. Right? So what I mean to say that in ICD-11, what I mean to say that in ICD, oh God, right? So ICD 11 is recognizing that key the compulsions are behaviors. The first addition is including the repetitive mental acts, which was not there in ICD 10, that the person has to perform in relation to obsessions. Okay, it was there in ICD 10 also. But this part, according to rigid rules or to achieve a sense of completeness, right? These further two parts have been added in ICD 11 in definition of compulsions, right? So again, for a revision, what are the changes in the definition of obsession and compulsion? So obsessions, firstly, key obsessions can be repetitive, persistent thoughts, images, impulses, or urges as per ICD 11. And secondly, in compulsions, firstly, they have recognized that the compulsive acts can be repetitive mental acts also that the person performs, not just in the response to obsession, but for certain rigid rules or to achieve a sense of completeness also. You know what this sense of completeness they are telling about? Sense of completeness, we had talked regarding just right phenomena, no? Right, something is not right, right? I do not know what I am doing it repetitively, because something is not right, not because I am having repetitive thoughts, right? But because it has not been rightly done, right? That compulsion for the sense of completeness they are including here, right? So firstly, this change has been there in your OCD group. What other changes have been there? Other changes, OCD in ICD 10 was, as I told, predominantly obsessions, predominantly compulsions, mixed obsession and compulsion, other and unspecified, right? But what has been done is that now they recognize that this differentiation into obsession, compulsion, or mix, it is not making any sense. Most of the people have mixed obsession and compulsion, and treatment is not going to differ. So now how the OCD is divided? Obsessive compulsive disorder in ICD 11 is, which is a 6B20, is divided with obsessive compulsive disorder with fear to good insight and with poor to absent insight and unspecified. So it will be your 6B20.0, 6B20.1, 6B20.z, right? So this is how the OCD group has been divided. OCD, which is coming under OCRD category, which is 6B2. Then OCD 6B20 with fear to good, poor to absent, and unspecified, right? First part. And here I would further like to add that with fear to good insight, and how they have differentiated poor to absent insight and fear to good insight. See, with regard to fear to good insight, they have told that here the individual is able to entertain the possibility that his or her disorder or belief may not be true, and and can uh, and can accept an alternate explanation, right? So fair to good insight is when the person has insight, but how the person is able to entertain the fact that ki, his beliefs may not be true and is able to accept alternate explanation. But what about absent to poor insight? The good thing about OCD with the poor to absent insight, about ICD 11 is how they have defined poor to absent insight. I mean OCD with absent insight. Where to include it? Is it a delusion? Is it coming under schizophrenia? Right now, what it is, they have told कि when we will make the diagnosis of OCD with absent to poor insight, okay, the person has obsessive compulsive disorder fulfilling all the categories. See, in obsessive compulsive definition, nowhere they have talked that the person is recognizing the insight part is not there, right? The person should have insight, right? They are not talking about this aspect in the definition, right? So basically repetitive acts or repetitive thoughts, images, impulses, urges, right? So this repetitive component is there. But when we will use absent to poor insight, okay, the person is fulfilling the criteria for OCD, but here the individual is convinced that his beliefs are true and is not able to accept alternate explanation, right? So the thing regarding OCD is that the person believes that his thoughts, his beliefs are true, and is not accepting any alternate explanation for it, which means that key in the absence of other psychotic phenomena, if the person is fulfilling criteria for OCD, but the OCD is at delusional level, so we can make the diagnosis of OCD with absent to poor insight. Okay. So OCD with a delusional component to it will give you the diagnosis of OCD with absent to poor insight, right? Okay. So this is what has been changed in OCD, right? So first we discussed regarding OCRD. In OCRD, we have OCD, the change in obsession definition to include thoughts, images, impulses, or urges. Compulsion definition to include mental acts for the sense of completeness, done to form the sense of completeness or to follow the rigid rules. And the subdivision has been changed to no more into obsessions, compulsions, or mixed, but rather into with a good insight, with absent to poor insight. And they have defined beautifully what absent to poor insight will include and unspecified. Okay, this has been the change made in OCD group. Right now, after OCD, the second category, which is 6B21, body dysmorphic disorder, which was earlier embedded in hypochondriasis, which was a part of somatoform disorder. So kind of body dysmorphic disorder is a new entity. Now what body dysmorphic disorder is? It is characterized by persistent preoccupation with one or more perceived defects or flaws in appearance that are either unnoticeable by others or only slightly noticeable to others. Right? So preoccupation with the perceived defects, and those defects are either are not there or might be visible to others very slightly. And The other thing regarding body dysmorphic disorder is that the person experiences excessive self, the person is excessive self-conscious, can often also deal with ideas of reference. Ideas of reference like the fear of being judged, the conviction that people are talking about his defect, right? For example, I have a belief that my nose is misshapen, so I might be very much conscious about my nose shape, or I might have excessive ideas of reference. Oh, I think that person is noticing my nose, ki how misshapen it is, and he might be laughing at my nose. Oh God, why he is noticing it, right? And okay, so the person is excessive self-conscious or have ideas of reference. And the third component is the person engages in repetitive and excessive behaviors that include repeated examination, repeated examination of appearance or severity of repeated examination of experience, excessive attempts to camouflage the defect, excessive attempts to camouflage the defect, avoidance of social situations, avoidance of triggers that increase distress about perceived defect, right? And of course, the last fourth component, it should be significant enough to cause socio-occupational dysfunction, socio-occupational, familial, personal, educational dysfunction, right? Or in other areas of life, right? So, body dysmorphic disorder, new entry, right? And what are the four components of it? Number one, the perceived defect, which can actually be there but slightly noticeable to others or not there at all. Person is self-conscious and might experience ideas of reference like being judged. People are talking about the defect, making fun of the defect. Person engages in excessive repetitive behaviors, right? Self-examination, trying to camouflage, avoidance of social situations or triggers, and excess and associated with a significant dysfunction in various areas of life. And body dysmorphic disorder again is divided into body dysmorphic disorder with the fair to good insight, with the poor to absent insight, and unspecified. And what will be fair to good insight? The person is able to accept that his beliefs might not be true and is able to take some other explanation for it. Poor to absent insight, the person believes that his beliefs are true, conviction is there, not able to accept alternate explanation. And unspecified, right? Okay, body dysmorphic disorder. So in OCRD, OCD, body dysmorphic disorder, the third category, olfactory reference syndrome. Right? What regarding the olfactory reference syndrome? Again, olfactory reference syndrome is the new entry. What is the thing here? The person, the person is characterized by mostly same as body dysmorphic disorder, but just check out the difference in the language, right? So persistent preoccupation with the belief that one is emitting foul odor or breath. Okay, one is emitting foul body odor or breath that is either unnoticeable or slightly noticeable to others. Right. So one, preoccupation with the body odor or breath that is either unnoticeable or slightly noticeable, almost same as your hypo body dysmorphic disorder. Then again, the second line is the same. The individuals experience excessive self-consciousness or even ideas of reference. Then, in response to the preoccupation, the person engages in the excessive and repetitive behaviors like checking, seeking reassurance, attempts to camouflage, avoidance of situations or triggers that increase this avoidance. Right. And the fourth component associated with marked dysfunction in various areas of life. Right. So olfactory reference syndrome almost the same as body dysmorphic disorder, but associated with the foul body smell, foul body odor or breath. Right, rest all is almost the same, and again it is divided into olfactory reference syndrome, which will become 6B2 2. Yes, it will be with good to fair insight, with poor to absent insight, and unspecified. So 6B2 2.0, 0.1 and point C. Right. This is what is olfactory reference syndrome, right? So OCD, body dysmorphic disorder, or olfactory reference syndrome. Then is hypochondriasis. What's the thing regarding hypochondriasis? Okay, so this is the same what has been there in our ICD 10. The hypochondriasis is the same, except that it has moved out from the somatoform to the OCRD group. And hypochondriasis, here the person has a persistent preoccupation with the fear about life-threatening disorder. Life-threatening disorder or very serious disorder. See, what has been the difference in hypochondriasis and somatoform disorder in ICD-10? In a somatoform disorder, the person had believed that he might be having some illness, and it was not he is having some pain which can have some organic underpinning to it. Somatoform was more like this. But in hypochondriasis, the thing is that this preoccupation regarding this life-threatening component, this is what makes it hypochondriasis. I am having pain in my stomach, it is cancer, it is tumor, right? So basically hypochondriasis is preoccupation with catastrophic misinterpretation of bodily signs and symptoms, which can, so this catastrophic misinterpretation is the main component of hypochondriasis. Hypochondriasis definition is remaining the same, right? And as such, big person gets engaged in repetitive and excessive health related behaviors, or even in maladaptive avoidance behaviors. related to health. Right. So the person engages in repetitive and excessive health related behaviors or even maladaptive behaviors, avoidance of some behaviors which can be maladaptive to health. Right. This okay, so first part of the definition, preoccupation with the life threatening condition, even of the normal sensation, preoccupation with the catastrophic misinterpretation, repetitive and excessive health related behaviors or maladaptive behaviors such repetitive examination, investigations and even surgeries. And it persists despite persist or recurs despite appropriate medical reassurance or evaluation, and of course associated with significant distress, etc., in various areas of life. Right. So I hope you have got what hypochondriasis is: preoccupation with the some serious life threatening disorder. It is mainly the catastrophic misinterpretation of normal of bodily signs and symptoms or even normal sensations associated with repetitive excessive health related behavior or maladaptive behavior. The person, it persists or recurs despite appropriate reassurance and evaluation and associated with marked dysfunction. And again, hypochondriasis is divided into with fair to good insight, when the person is able to take the alternate explanation, with absent to poor insight, and unspecified. Right. And it will be our 6B23.0.1.Z unspecified. Okay. Right. This is what is hypochondriasis. And hoarding disorder. What is hoarding disorder? So hoarding disorder, okay, I am telling you, it is a new entity, new entry in ICD 11. Hoarding disorder is common with various psychiatric disorders, but as per ICD 11, now we can make the independent diagnosis of hoarding disorder if occurring with schizophrenia, if occurring with depression, if occurring with intellectual disability. Right. The independent diagnosis of hoarding disorder can be entertained. And what it is characterized by accumulation or possession, accumulation of possessions due to excessive acquisition or difficulty in discarding. Right. So it is accumulation of various articles either because of excessive accumulation or difficulty in discarding the possessions. Right. The person has repetitive urges or behaviors related to buying items or collecting items regardless of the need. The person has a difficulty discarding the objects and it is associated with distress. The accumulation is up to the level that it even compromises your living space. Compromises your living space. It compromises your living space, it compromises your safety. And it results in, of course, dysfunction in various areas of life. Okay, so accumulation of possessions, urges or behaviors to buy items or collect items, difficulty discarding them and is associated with distress. Accumulation is up to the level that it compromises your living space and safety also, and of course associated with dysfunction, right? This is what will be the 5 criteria for the hoarding disorder. Again, hoarding disorder will be 6B24, and what will be the 3 subcategories to it? Hoarding disorder with good to fair inside, with poor to absent inside, and unspecified. 6B24.0.1.Z, right? This will be what the hoarding disorder is. And next is our body focused repetitive behaviors. Right? What is happening here in body focused repetitive behaviors, which includes trichotillomania and excoriation disorder, also called as skin picking, of which skin picking or excoriation is the new entry. Trichotillomania was under habit and impulse control disorder, but now under body focused and repetitive disorder, which is coming under OCRD. Body focused repetitive behavior is the new terminology introduced, and it will be your 6B25. So trichotillomania is a 6B25.0, excoriation 6B5.1, right? Trichotillomania, okay. What is now trichotillomania? Okay. Firstly, no, we should know what is body focused repetitive behaviors, right? So in body focused repetitive behaviors, firstly, note that there are no preceding obsessions or thoughts or impulses or images, right? So it is, these are repetitive, body focused repetitive behaviors are mode of acts, not preceded by any thought, but might be preceded by some sensation that urges the person to carry out those repetitive acts, right? So body focused repetitive behaviors are the acts, repetitive acts that might be preceded by some sensations. The person in body focused repetitive acts engages in some actions that are directed at integument. Body focused repetitive behaviors, the person engages in acts that result in integument, like hair pulling, skin picking, lip biting, right? Okay, integument, the pulling of the thing from the base, integument. Body focused repetitive behaviors, repetitive acts preceded by some sensations, the actions being directed at integument, which might be integuments like hair pulling, lip biting, skin picking, right? And the person unable to stop this, and it might result in the dermatological sequel also, like hair loss, skin lesions, lip abrasions, right? So dermatological sequel, right? So I hope what we are including, you have understood what we are including in body focused repetitive behaviors, mainly a focusing or pointing at pulling out of the things from the skin or body, like hair, lip, skin picking, right? The person not able to stop them, right? One. Then this is what is body repetitive behavior disorders. Then what is trichotillomania? Tilomania, which was earlier under habit and impulse control disorder, now under this OCRD group, under body focused repetitive behaviors, right? Pulling of hair and excoriation disorder is your skin picking. Basically, the skin can be picked from any part, and hair can also be pulled from any part of the body where the hair grows, right? So this is what has been covering under OCRD group, right? OCRD group includes your OCD, BDD, ORS, hypochondriasis, hoarding, body focused repetitive behaviors, trichotillomania, excoriation, others, and unspecified, of course, right? This is what is there and what are the differences and what they basically mean. Right, just let me check for anything I would like to add. Just give me one more minute. You know, again, one thing I would like to tell here, that in ICD-10 it was written that if depressive disorder is present, OCD should not be diagnosed, right? Comorbidity diagnosing was not a major feature of ICD-10, though we used to make, but as per ICD-11 we can make the diagnosis, comorbid diagnosis, as I have been discussing. Yes, this is what has been there in OCRD group. Now in with OCRD group, we will be discussing just a minute, right? We will be discussing another entity also, right? So like your OCRD was there, which was 6B2. Similarly, we have another entity which is disorders of bodily distress or bodily experience, right? OCRD has various categories under it, right? Similarly, disorders of bodily distress and bodily experience, which is 6C2, right? Right, we will see what comes under this category. It includes mainly two disorders. These are bodily distress disorder bodily integrity disorder, dysphoria, body, or I should use body integrity dysphoria. 6C20, 6C21. And of course, others and unspecified, right? Now, you know which group this actually is, disorders of bodily distress or bodily experience. It is actually corresponding to your somatoform disorder, right? So if you will see, as I have told in the starting of the class, right here, right? F45 was the somatoform disorder, but now it has been renamed, right, in a different category. We will see somatization undifferentiated, sorry, persistent somatoform pain, others unspecified. These all have come under one category of bodily distress disorder, and one more entity has been added to it, right? So in ICD-11, what I mean to say is that there is no somatoform disorder, but disorders of bodily distress or bodily experience, and in that mainly bodily distress disorder is what is more close to your somatoform disorder, right? Now what is bodily distress disorder? Bodily distress disorder characterized by presence of body symptoms that are distressing to individual, the person paying excessive attention to them, and it can result in a repetitive contact with the medical health professionals, right? This is the one part. Bodily distress disorder, the body symptoms are present to which the person is paying excessive attention, and it requires to be in contact with the mental health professionals regularly, right? One, which is almost same as of the somatoform disorder. But what other thing this bodily, okay, so if bodily distress disorder is the same as somatoform, why they have not named it somatoform? Because they want to stress upon another thing. In somatoform disorder na, in somatoform disorder, it was written that okay, the symptoms are present to which the person give excessive attention, required repetitive mental health checkups, person is not, does not get reassured or gets reassured temporarily, and there must not be any organic or physical underpinning, meaning the medical or organic reasons have been ruled out. That was what was there in somatoform. But in bodily distress disorder, okay, there are symptoms to which the person is paying excessive attention and requiring repetitive health checkup. And in addition, they have told that even if some actual health condition is present, the degree of attention is clearly in excess with respect to its nature and progression. Okay, so what I mean to say is that key, okay, say I have, I am having, yeah, I am having sinusitis, say, right? So, okay, I might be saying I am my heaviness in, okay, I might be experiencing heaviness in head, difficulty, phonophobia might be there, running nose may be there, right? Okay, but when it will become a bodily distress disorder, when I will be paying excessive attention to it. Okay, sinusitis is there, it will get fine. I will recover soon. It's okay. I should just be need on medication. It's not a big deal. Okay, thoda sa discomfort I am having, but that's okay. But when the symptoms are taking toll on my mental health also, and all I am doing throughout the days paying attention to these symptoms and not engaging in other activities and talking about these symptoms only, right? So this is what they have added in bodily distress disorder, that even if the person has some actual medical conditions, the attention paid is in excess of what is required, right? And then the third component to the definition, the attention is not elevated by even repeated medical examination or checkups or reassurances, right? So the component of medical reassurance is the of the excessive attention to the symptoms is the main, right? This is what is a bodily distress disorder, and of course associated with the dysfunction in various dysfunction in various areas of life. And bodily distress disorder is divided into mild, moderate, and severe, right? So bodily distress disorder will be 6C20, mild will be 62C 0.0, 0.1, 0.2, right? One, this is what is bodily distress disorder. And the second part, body integrity dysphoria. You know what is body integrity dysphoria? That has been added into the category bodily symptoms, disorders of bodily distress and experience. Body integrity dysphoria is an intense desire to become physically disabled in a significant way, like major limb amputation, paraplegia, blind, right? This usually has onset in adolescence. It is associated with marked discomfort or distress that no disability is present. The distress of being non-disabled might be associated with harmful consequences. This distress might be associated with harmful consequences, such as the person engaging in the act to achieve the amputation or permanent disability, like self-amputation, like putting the health at risk. Or the person might be, say, spending excessive time, say, on wheelchairs, using blind specs, right? The behaviors are such, or the person engaging in harmful consequences, like putting the limb in dry ice for amputation, right? Self-amputation, health has risk. The behaviors are associated with the achieving or simulating the major physical deformity, the person having discomfort that no disability is present, right? Body integrity dysphoria, the person having the desire to become physically disabled, right? So this is what are the two categories under disorders of bodily distress or experience. Number one, bodily distress disorder, more near the somatoform, but the extensive thing that has been added is that even if the physical disability is present, it is the attention given is in excess. And secondly, body integrity dysphoria, in which the person has a dysphoria, discomfort regarding the body integrity, and wants to attain some major physical deformity. Right, just give me a minute to check if I am forgetting onto anything. Right. So these are the two disorders mainly covering the somatoform part and OCD part of ICD-10, right? How OCD part has changed? OCD part has become OCRD, and how the somatoform part has changed. It has been subsumed under the major category of disorders of bodily distress and experience, in which disorders of bodily distress more so close to the somatoform, and body integrity dysphoria is there, right? So So OCD and somatoform of ICD-10 are now these, right? So eventually over the next few classes, we will be covering these main changes in F4 category of ICD-10, right? Like anxiety disorders and dissociative disorders, right? Thank you guys. So this is it for today's class. Happy reading. Please feel free to ask us your queries. You can always contact us on ad, right? Okay, take care.